Dr. Anita Parker here, helping you become the best chiro you can be and helping your patients. Today I want to show you some tips on how to adjust your patient's feet a little bit more effectively, especially if you're a smaller DC like myself, and sometimes you don't have as much weight to really work with, or your patient's a lot larger. Some of these tips might be helpful for you to also get better with your extremity adjustments. So the thing about feet is, most importantly, is trying to make it as comfortable as you can for your patient, because I don't know about you, doc, but I'm pretty ticklish in my feet. So if someone grabs a hold of my feet, I'm like, ah, and I'll start laughing and giggling. So you want to avoid that from happening. How do you do that? By just having a really good, comfortable, firm touch, not a tickly touch, right? You don't want to be poking at their feet. You want to take the fleshier parts of your hands to make them not feel like they're ticklish or get nervous. So that's why I use both hands on feet. I like to use both hands, and I'm thinking when I do feet, I'm always thinking about what the arch should be like. So we know we should have an arch in the feet. So I'm going to try to adjust her to reinforce her arches, and in doing that, a lot of these bones will adjust. Okay, so I'll show you now on her foot. I'm just taking my hands on both sides. I'm taking my fingers like this, going underneath her feet, and I'm just trying to reinforce here that she should have an arch. And in doing that, I'm going through the toes where we should have an arch. And it doesn't mean that you're gonna get an audible or a pop on these. Sometimes you do though, okay? But even if you don't, it usually still means you're adding that comfort. How does that feel? Comfortable? Good. Okay, so all I'm doing is just kind of this motion to bring that bridge of that arch. Okay, so now that I got that kind of going on and she feels pretty good here, next spot that gets most subluxated is this talus, right where the ankle joint is. So I want to make sure I check this segment here. So I like to do a double thumb cross here. Okay, just it gives me a little more control. If you don't like that, you don't have to do it this way, but again, just you can also go like this just to reinforce the talus, the bone that you're adjusting. So going up to the top here, I guess this is like also navicular, huh? We're gonna take the whole weight of her leg, so she doesn't hold her leg up. I like to keep her leg as close as I can to the table. It gives me that weight and traction to give her a good adjustment. I'm gonna take my knees on both sides of her ankle, so now I have kind of the area I want to release, and she's pretty stable. And then all the adjustment takes, I already have my tissue traction with my double thumb, I got my knees ready to go, and all I have to do as a smaller DC is just lean my body weight back, and we had a really, really great release on that. Does that feel good? Mm-hmm. Okay, so that's how you're gonna do this part. Third part, check the heel, because so many of our patients are getting plantar fasciitis, they're wearing the wrong shoes, they're walking on hard surfaces, right? So I take the whole heel of her foot, and I'm gonna place it in my palm of my hand like this. So now she feels supportive, right? Other hand is gonna come to the top. And then again, just like I showed you with the last adjustment, I'm using my whole body weight to pull it back. Okay, so again, you can also have your hand this way and just check and make sure everything's moving. There we go, and move your sock back up, okay? And with this, docs, it's always a good thing to check the knee, because knees and ankles kind of go together in terms of subluxations. So I'm just gonna check her patellar joint here, tissue traction, come on up, and we're gonna move that way. Okay, last, she didn't have a big patellar adjustment. I wanna do the knee joint itself. So I'm gonna cross my hands underneath her knee like this, so it gives her support. And then I shake her. Why am I shaking her? Because I want to remind her, hey, let the whole weight of this leg go, relax. And when she does, I lean right back. And the adjustment is to separate or traction this area, which can be immensely helpful for your patients who suffer with knee, ankle, foot pain. I hope this was helpful for you. Please keep your questions and comments coming.